Well, this is Echo. She's 20 years old and I've had her for 13 years. About 18 months ago she had a bout of laminitis, which she recovered from very quickly. She was on box rest. And then about 6 weeks ago my farrier came out for a routine shoeing and just happened to mention to me when he put her shoes back on and was banging in the nail, she was a little bit sensitive. And a couple of days later she became a bit pottery, so we took her in the box and called out the vet Dave. He came out and said yes, she did have a touch of laminitis, and he also did a cushions test which came back positive. The vet came out and removed her shoes, so she has no shoes on. So today she's here for a reassessment and for the farrier to look at her feet.
Right, Richard, this is Echo. I saw Echo out on the road a few weeks ago and diagnosed her with acute laminitis. So she's come into the hospital today to see you to try and find a better way for her forward shoeing-wise. She's improved quite a lot on the bute that she's been on and with some box rest. She's also had some endocrine issues, some Cushing's issues that we've addressed. But really it's a case of you just assessing her, if you wouldn't mind, and then just trying to find the best shoeing solution we can to take her forward.
So having had a chat with Dave about the brief history on Echo, now we're going to have a look at her move. We're going to see what she moves like both in a straight line and on circles. Circles are very often the most telling of movements, and also we're going to have a little look at her statically as well, because that'll tell us a lot about her comfort levels and also what might be appropriate farrier wise. Look for demeanour too, as well as footfall. She's trying to land slightly heel first. She's landing outside first, but she has got some growth on there which would explain a lot of that. A little bit slow on the turn, but she is barefoot. She's also slightly base wide, so yeah, I'll take all that into account. So her little legs come down and they just slightly rotate outwards, so just allow for that also. If you notice, slightly short, shuffly gait. Ears went back almost immediately, not really over keen on getting on with that. Next test I'm going to do is I'm just going to see what this little horse looks like when it's turned in very tight circles. Nice and tight, and just go around 2 or 3 or 4 times, that'd be great. What we're looking for is a nice crossover of limbs. You see she's doing her best, but she's reluctant. And then perhaps you can go the other way. That's lovely.
So we're going to take some x-rays of Echo's feet. Okay. We've got our lead gowns on for protection. Yep. What we're going to do is pop her foot onto a wooden block so that we can take a sideways view so that we can see all of her foot and image the bones in her foot. Okay?
Yeah, that's fine.
Right, Rich, this is the right foot. This is the worst one, which I guess is the same as we saw clinically. She was more sore on the turns, wasn't she, on the right? There's a bit of rotation, isn't there? That's not quite parallel with the hoof wall.
Indeed.
Possibly a little bit of lipping there, which may fit in with the chronicity if this has been going on 18 months or so. If the coronary band's there, it doesn't appear as though there's been a large amount of drop there, so it doesn't appear the pedal bone is displaced into the foot, just rotated a bit. And I guess I'm quite pleased to see that we've got quite a lot of sole here to be able to work with and quite a lot of heel, so hopefully you can get that back and try and realign the mechanics so that we've got the wall parallel and drop the heel down just to get things back the way they should be.
It's nice to see a foot like that that's got some material to work with.
Yeah.
You know, very often you've got so little to make many changes that then becomes a struggle. So that foot looks like it's in fairly good shape.
Out of interest, Richard, I thought I'd show you this one. This was a horse that came in a couple of weeks ago that had a 6-week history of laminitis. It was a big horse and it was very overweight. So whilst there wasn't an opportunity to do any endocrine testing, unfortunately I think it was fairly apparent that it would have been a metabolic syndrome endocrine laminitis case. Yeah, you can see through the different shades of grey here through that area there. There's obviously separation there. That's just a gas shadow where the hoof wall there is completely pulled away from the pedal bone, and then the tip of the pedal bone is just dropping through the sole, and I could see that before I took the radiographs. But these were just to confirm the severity of the situation, and that's just a drawing pin there as a marker for us. But
just makes you realise how drastic it can become.
Yeah.
Terrible tragedy for the owner and the horse, that one.
Yeah. Right, Richard, let's see what you think. She was obviously quite sore on the turns, and we know there's some radiographic changes there with some rotation. So in your hands really as to what you think the best shoeing option is.
Sure.
Whether she justifies clogs or whether we have some other kind of support with a pad, I don't know, but see what you think.
Okay, well what we'll do is, as you say, we've seen her move and we've seen how she turns, etc. So now we're going to make a visual check and see what we've got foot-wise, see how much damage has gone on and what we might be able to do that's appropriate for that. Okay, first thing I tend to do when I'm looking at these horses, Dave, is I run my finger down over the top of the coronary band and feel if I can feel a depression
That'll tell me whether the peeler bone's slightly moved, how much of a movement has gone on there. If there is much movement going on, you'll feel literally a physical trough in there. Depending on how much detachment's occurred, depends how far around that trough will occur. If you look at the outside of the foot appearance, we've got these rings, classic laminitic rings. The way to tell the difference between, in my eyes, David, with laminitic rings and grass rings is laminitic rings tend to be wider at the heel and they tend to bump into each other towards the toe. And that's just where the heel growth is either the same or increased and the toe is compromised somewhat. So I think we've got some classic changes there. We've also got quite a nice straight spot coming out of the coronary band and this sort of bulge at the bottom half where she's had previous attacks. That's a sign that that's gone on in the past. Looking at the bottom of this foot, there are some changes going on that tie in really well with the x-rays that we looked at a little earlier. If you look at the sole condition, it's a little flat. What we like to see a bit of concavity in there, and that's a little flat, maybe even a little bit convex, but it's a sign that that pedal bone, the bone inside, has been pushing slightly downwards and forcing that sole into a flatter state. So we need to accommodate that. The heels have grown tall and moved forwards, but we have got a huge, lovely, big, healthy frog, so we can use that very much as a weight-bearing structure to help support this little horse. The bars themselves are running around here, the continuation of the wall. You can see they're trying to grow around the actual apex of the frog. That's classic in a chronic laminitic that's had a few bouts. They tend to grow really strong bars. It's almost like a secondary hoof wall, nature trying to actually sort of reinforce itself and give itself as much support and rigidity as it can. All I'm going to do is I'm going to put some hoof testers on her. So I'm going to start just around the toe and work my way backwards. She's got a little bit of reaction there, a little bit there. You can just watch her muscle response. A lot of horses will respond anyway to you're just squeezing their foot, but if you do a repeated squeeze, they'll get fed up and reacting to just being squeezed, as it were. Then I'm going to feel over the frog as well, because sometimes when the peeler bone has moved slightly, it tends to move backwards. So in a typical horse, the tip of your bone would be situated around like so. Actually, with a lot of laminitics, David, it tends to move backwards. So you want to make sure that your frog is not too painful if you're going to use it as a means to load. Trim-wise, these heels are very stacked up. They've run forwards. If we were to take the widest part of the foot back here, the widest part of the frog, we can see how far forward these heels have moved in relation to the back of this foot. So we're going to trim this foot. We're going to call what we call a derotation trim. So we're just going to trim the heel back slightly and use this back part of the foot as a platform with which to load this foot and try and relieve some of the pressure from this front half. Whatever your farrier and your vet are used to using, they have success with, then use that. Just because I'm using this one product doesn't necessarily mean this is the only fix in the world. So I'm going to use a Steward clog. It has a number of features in it that will really play into my hands. I can use a product underneath to help load through those structures in the back half of the foot. The clog itself allows for easy multi-directional breakover, so it makes it easier for the horse to turn the corners. The curve on the top of the shoe is slightly inside the laminar bed, so that makes it a lot easier for them on the turns. There's a good radius at the toe for them to break over, so you reduce tension through the tip of P3 as they go to leave the ground. The fact the horse has grown his heels up and he's moving onto his toe, we can derotate this foot, move it back to the back half of the foot, realign those phalanges, those bones inside, and hopefully make this horse a little bit more comfortable and set him up to heel that much better. The trim and the placement certainly is no matter what product you're using, that's the most important part. But once they've had it, you do need to try and offer them support and a place to heel, and using some prosthetic is usually the best way to do that. So I want to try and avoid, Dave, this area here over the tip of the bone.
Yeah.
So I'm just going to trim this foot from here backwards.
How many shoes do you think it's going to take to get the foot mechanically as it should be, rather than as it is now, as we can see on the radio?
I would say about three shoes. We should be just about there. This is not a bad foot. It's not hugely out of whack. I'm not going to take a lot of these bars off, David. I'm going to leave a lot of that in there. So that's just the back half of the foot been dressed from there backwards. So we're going to be predominantly using this back part of the foot. I'm going to use underneath our clogger a little impression material. It's just a rubberized product that will go off underneath, but I'm going to put it in the back of the foot. So I'm going to use that rubberized material to fill that void, which will then make contact with the clog or whatever it is I'm going to use on top, in this case the clog, on top of that. So it'll help push from the ground through the clog and then into the back part of the foot. Okay, Dave, this impression material should have gone off by now. So we'll just take this base plate pad, just helps the impression material set off flat.
Yeah.
The trouble is, if you don't use that, you tend to get a bulge in it. I'm just going to put a smear of magic cushion just around this sole just to help keep it clean. This is a product that will help stop the foot getting smelly and unpleasant underneath. I've drilled 2 little pilot holes down through the foot and I'm just going to attach. Okay, and now we're going to apply the casting tape. This will help hold the clog in place and also just give the foot some rigidity. So there's not as much flex through the hoof wall as they load and unload the foot. It wants to be applied by a veterinarian or a farrier who's practiced with the product.
Right, Julie, well, I hope you're happy. I'm very pleased with what Richard's done. I think whilst she's still obviously got some way to go, I think she's moving better. She's keener to go forward and she's better on the turns, I think, and her ears are pricked and she looks happier on those feet. So, so I think that's all good movement in the right direction. And obviously that will start to address those changes that we've got there in the feet. In addition to obviously the medication that she's on for her Cushing's disease, which is likely the underlying cause of all this and certainly making a big contribution towards the development of the laminitis. So if we've dealt with the cause and if we can deal with those secondary changes, then hopefully she's right on track.
She's definitely brighter in herself than she was before she was on the medication, and she's definitely moving better now since Richard shooed her. So she looks happier all round, which is brilliant.
Yeah. Well, let's get that blood in a few weeks' time just to check she is still on the right dose, and we'll go forward from there. But
Great.
hopefully we're getting sorted.
Thank you.